Hi, you guys. Welcome back for our daily practice questions. It is day 154, and our Pharm series is continuing. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And before we get started, don't forget to hit the subscribe button so you do not miss any of my upcoming videos. And if you're looking to gain access to my MP Test Success Toolkit, it's free and linked in the description. Question number one states, a 30-year-old non-pregnant woman presents with dysuria and urinary frequency. Your analysis confirms an uncomplicated UTI. What is the most appropriate first-line treatment? Is it A, Cipro for 7 days? Is it B, nitrofurantoin 100 milligrams BID for 5 days? Is it A, Bactrim BID for 10 days? Or is it D, Augmentin for 7 days? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question. I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate first line treatment? So, I always tell you if they're looking for a treatment, you need to run it back and see if they have provided you with a diagnosis. In the event that they have not provided you with a diagnosis, you got to run it back a step further and look at those assessment findings. So here, the diagnosis is an uncomplicated UTI and it has been provided. So, what is your first line treatment for uncomplicated UTIs? And your best answer is B, nitrofurantoin 100 milligrams BID for 5 days. Remember, one, nitrofurantoin is in that first line therapy options, but also when they're talking uncomplicated versus complicated, always pay attention to the duration, right? Because remember that it's not so much of the medication that we utilize for uncomplicated versus complicated, but how long the treatment is prescribed for, okay? But I'll go into those numbers after we kind of finish some more of these questions, so I'm not giving away answers. All right, question number two. A 58-year-old man with diabetes and a fever presents with flank pain and urinary urgency. What is the best initial first line treatment approach for this complicated UTI? Is it A, nitrofurantoin for 5 days? Is it B, Bactrim for 3 days? Is it C, oral amoxicillin for 7 days? Or is it D, an oral fluoroquinolone for 7 to 10 days? Take a moment and tell me what you got. All right. So, stem of the question here states, what is the best initial first line treatment approach for this complicated UTI? So, this stem of the question tells you everything. It's telling you what is the first line treatment for complicated UTIs, right? And your best answer is D, an oral fluoroquinolone for 7 to 10 days. Now, remembering how we treat UTIs, but also complicated UTIs are treated longer. So with uncomplicated, we treat from anywhere from 3 to 5 days. And with complicated UTIs, we treat from anywhere from 7 to 14 days. And then lastly, question number three. A 35-year-old woman presents with fever, chills, CBA tenderness, and positive nitrites on a urinalysis. What is the first line outpatient treatment if she is stable? Is it A, nitrofurantoin? Is it B, amoxicillin? Is it C, Cipro for 7 days? Or is it D, fosfomycin? Take a moment and tell me what you got. All right, all right, all right. So, stem of the question here states, what is the first line outpatient treatment if she is stable? So, okay, again, with treatments, we have to identify if they provided us with a diagnosis. And if they have not, then you have to look at the assessment findings so that you can determine the diagnosis. So they haven't provided a diagnosis here for this scenario. So we want to break things down. So we have a 35-year-old woman. She has come in with fever, chills, CVA tenderness, and positive nitrites on a urinalysis. So those positive nitrites, remember, positive nitrites and leukocytes confirms a UTI diagnosis, right? So we know there is something going on here. But also, as I always tell y'all, pay attention to the key identifiers. When I say this, you say that, right? So when I say CVA tenderness, you should say acute pyelonephritis. So how do we treat acute pyelonephritis? And your best answer is C, ciprofloxacin for 7 days. Okay, so make sure you know your treatments. Make sure you are able to identify uncomplicated versus complicated, because they're not going to always tell you that it's complicated in the scenario or uncomplicated. Remember that uncomplicated UTIs are females who are not pregnant who have standard symptoms. So just like your frequency, your urgency, your dysuria, they haven't been on treatment already. Whereas complicated are pregnant women, the elderly, and males. So make sure you're able to identify these so then you know how to pivot and treat these, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. And if you look in the description, you will see the updated live website that gives you access to everything that I offer and navigates you through if you're a first time test taker or if you are somebody that is retesting which resources are best for you. All right, you guys, as always, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.